Here we go. Is it recording? Yeah, it's recording. 2, 3, 4, 5, 6, and 7. Okay. And here is the camera. Okay. Can you see me?
Baking into people. Okay.
Back up. Is it good?
It's good.
Okay. Did you know that according to the National Institute on Deafness and Other Related Conditions, roughly 3 million Americans have a form of stuttering. I chose this as a topic for this speech because I'm doing this for Communications 111 speech. For Communications 111, and stuttering is a common speech impediment. So I thought learning about it in a speech would be a good idea for a class like this. I will be going over the definitions of stuttering, the causes of stuttering, and what the different treatments are for stuttering. So we are going to proceed to the definition of stuttering. According to the Mayo Clinic's web page on stuttering is also called stammering. It is a prolonging of a certain word or certain sound of a word. It is also a repeating of a word or a sound. It can also be stopping in the middle of a word or a sentence and being unable to say a certain word. Stuttering is common in children. It is something that most children do outgrow. However, chronic stutterers do continue to stutter through their adolescence and adulthood. According to Doctors Ramomaridi and Wells, children rapidly blink when they stutter. They typically stutter around 2 to 6 years of age. Boys stuttering more than girls. And here is a YouTube video of a kid stuttering.
Have you ever had a dream that you could do so you want him to do you so much you could do anything?
There are 3 main accepted causes of stuttering. The first is developmental. They cannot say the words that they're thinking. They know the words that they want to say, they just can't speak it out. This is typically outgrown as a child gets older. A second has to do with the nervous system. The muscles involved in speech are damaged. The brain, specifically in the speech center, is damaged in some way due to a stroke or injury or head injury. The nerves can also be damaged, causing issues with speaking. The third is how somebody thinks or feels, psychogenic in nature. This generally happens to those who are extremely anxious or people who have mental illnesses, though few children with mental illnesses do stutter, apparently, according to the good doctors. There is no cure for stuttering. The National Institute for Deafness and Related Conditions stated in their 2010 web article on stuttering that one of the major ways that people treat stuttering is through therapy. Speech therapists use breathing methods, building up of small one-syllable words to longer syllabled words and more complicated phrases. They also concentrate on making sure that the person who speaks and is stuttering speaks more slowly so that they can form the words correctly. And they also make sure to minimize anxiety when speaking in certain situations, like speaking, giving a speech. Certain drugs that have been shown to control some stuttering, but it's not like it's a drug for stuttering. It's like antidepressants, anti-anxiety meds, and medications for epilepsy have shown that they can also help to control stuttering. However, the long-term side effects of using such drugs are far more negative in consequence, and the NCDID has found in a study that they're largely ineffective. In addition, electronic devices are used by some people who stutter. One such device fits over an ear. While the person is speaking, the device picks up what they're saying and has a recording of their voice. It's in their voice and saying the words only when not stuttering. In the short term, it has shown to help some people, but can also be extremely confusing, and longer term or more permanent usefulness is unknown. The best method of treatment is, of course, self-help groups. I have told you about what causes, and also this is a treatment center. I have told you what causes stuttering, what the different definitions of the different clinical definitions of stuttering are, and how people control stuttering. This is a common speech impediment, and being able to understand our fellow people and to be patient with them is something that is needed. Thank you for your time. Okay. Huh?
You gotta make sure that you get
Candace again.
Oh, right. Thank you for reminding me. Okay, and stop. Stop.